So good morning, everybody. Molly and I here again. Been spending a lot of time together with some of you over the last few months. Good news is that we're switching topics, right? That we're not talking as much about layoffs and furloughs and more about getting people back to work, even though there are challenges associated with that. So hopefully we will be able to answer some of your questions today. All right, so we already checked the ball, or that you guys can hear us. So if I can figure out my mouse, then I'm going to go ahead and get started.
Okay, and so just about San Diego Employers Association, probably a lot of y'all are familiar with us, but we provide essential HR services and programs, so training programs such as this one. We are here available for our members when you have questions via email, via phone calls. We talk through with you kind of what the specifics of your situation are. And we keep members up to date with our newsletters of things that are going on. And a lot has been going on here in 2020. So hopefully it's been helpful for you all with our newsletter. And, you know, we're just the team here. We are dedicated to providing you with expert HR advice. We have our attorney, Chris Olmstead, who's on retainer with us. So if there's something that, you know, we don't know, or we just want to, you know, get clarification on, or if you need to be referred to an attorney, we have that as a resource available as well.
Okay, and also you guys probably know that a lot of these programs we're able to do are because we have a grant with the San Diego Workforce Partnership, and I've talked about them before. They're a great resource for employers that are looking to add to their employee pool. So maybe if you do have those employees that are choosing not to come back to work for whatever reason, they might be a good resource for you. You know, they, I think, focus more on maybe some of the more of the labor market, or employees that are having a little bit more challenges getting back into the workforce for whatever reason. And so, you know, they help with training and skills and interviewing and all that kind of stuff. And I've said this before too, the SDEA has used them personally to help with some of our online stuff, and it worked out great. So they've got their website on there, and I definitely encourage everybody to check them out.
And then your panelists today are Jennifer Jacobus, who's our Director of HR Services here. Also, we'll do a little shameless plug for the PHR California class, which Jen will be teaching come fall. So if you're interested in pursuing that, you can see on our, well, I'm not sure if it's up on the events page yet, but that will be
it will be. It's coming soon.
Okay, yeah. Coming soon, yes. And then me, Molly Wood, I'm an HR consultant here. And our presentation protocols, so as we've done with a lot of our kind of Q&A types of webinars, the first part we're going to be reviewing slides, providing some updates, and then the second half is going to be your questions, you know, your experiences as well with all of this. It's just so new that we're really all learning from each other, and we want to have these be a platform for everybody to learn from each other. If there's a question that we can't answer during the webinar, we'll research it, and we'll be sending the response, probably actually posting it on our webpage, the responses to the questions that we get. We will answer questions in the order that they're received, unless we get, you know, duplicate questions. And then please do use the Q&A rather than the chat box, because we can run a report on Q&A and we can't run a report on chat. So if you use chat and we're not able to get to it during the webinar, then we won't, it'll be lost.
All right. So now we got all the housekeeping out of the way. So we're talking about challenges today. So we're kind of basing off, Molly and I put this together, you know, based on, of course, information that we're learning, but probably more specifically about comments and questions, in hearing stories and the problems that our members are facing. So I think that's also a good kind of piggybacking on what Molly just said, encouraging you guys to ask your questions and sharing what some of the challenges you all are having, things that we maybe aren't covering here, because that's what's going to be most beneficial to everybody. If you're experiencing something, there's a good chance that somebody else is as well. So now we're talking about, or employees are talking about actually bringing their employees back to work, right? Certainly between the county of San Diego and the state of California with the reopening in different phases, I think we're kind of getting to the point where more or less everything is open, but of course with all the restrictions that we have to comply with, but good reasons for safety issues. So I know one of the things, you know, we've kind of been facing is, you know, our members asking, well, what is everybody else doing? You know, what's the challenge? I was in a board meeting or a marketing meeting this morning, and that was asked in our small group meeting. You know, what are we seeing? What are other people doing? It was related really more to kind of telework or remote working and what we're seeing employers doing as far as bringing employees back. And I know as far for me, and Molly can chime in, it's kind of all over the board. We are getting a lot of questions still about the process of bringing employees back, requiring them to come back, still dealing a lot with employees that are afraid to come back. Maybe if they're themselves, you know, have a compromised immune system or living with somebody. And then we've got some daycare things that we're going to talk about later. So I think with that question, it's important to realize that there isn't a one-size-fits-all approach, and I think that's kind of stating the obvious. But what's going to work for, you know, this manufacturing company over here might be totally different for the dentist office, right? You know, and what is feasible. You know, even though these we're opening up, and I don't think anything's changed, you know, as far as office employees, just using that as an example, where offices are open back up, but we still have that caveat of if we can work remotely, that is still encouraged. So questions, and we're going to kind of talk about the process and documentation and everything, but you know, do you order everybody to come back at one time? You know, meaning, you know, are we making this a requirement? I know if you talk to either Molly or I, and you're asking that question, we're still going to say, you know, if you can do remote work, and if it's working out, and that was the program I did last week on, you know, keeping your remote workers engaged, that from our perspective, and I think, you know, based off, again, the county and the state, that we're still going to think that remote work and teleworking is a good idea if it's working for you. You may consider phasing employees in as needed. You know, do you need everybody back at one time? You know, can there be different schedules? You know, what's that's going to look like? You really, and I think Molly's going to talk about this in a few minutes, but, you know, putting a committee together on how this is and bringing your employees back. I know one of the challenges that employers are going to start facing soon, if you're not already, is that your money from your PPP loan is ending. So while you will be able to keep those employees employed that you have on staff currently because you have money to continue their wages, that may change in the next few weeks. So while you've kind of maybe been going on, I don't want to say status quo, because I don't think that applies to anybody, but being able to pay your employees, if your loan money is running out, you may be looking forward for the first time even potentially, or relaying or furloughing some employees. So that may be something that we're going to be exploring too. But, you know, what do you have? Do you have jobs for all your employees, most of your employees? You really need to kind of start thinking about what that's going to look like.
Right. So a big thing that you want to look at is preventing liability. And I would say another aspect to think about in terms of bringing people back is, are you ready from a safety and from your social distancing and sanitation protocols? Are you ready to have all of your employees back at once? Because you may need to phase them in just for the logistics of it. So, you know, as best you can, you want to have a plan. There is the social distancing and sanitation protocols, which are on the county website, and all businesses that are open are required to have those completed and have them posted. There's also the safe reopening plan, and even if you've been open all this time, we are recommending that you do the safe reopening plan. Some of the information is redundant from the social distancing and sanitation protocols, but some of it is new, and we have had members who've told us that the Sheriff's Department came in and wanted to make sure that they were following all of their requirements. So don't know how frequently that's going to happen, but it's certainly a possibility. You want to have a designated safety coordinator and preferably a team if you can have a team, but you are required to have a specific person who's a safety coordinator, and that person needs to be available. So if you have multiple sites, you could potentially have one person be the safety coordinator for 2 sites, but they really are going to need to be available truly for both sites. So you might want to think about having an individual for each site. You want to show that you have put effort into the process, that you've thought about it. You're wanting to think also about, you know, when your employees have questions of why did these people come back or those people come back. You want to, and we're going to talk about transparency and communication a little bit later, but you really want to be able to show to your employees that you have done what you've done with their best intentions in mind.
Oops.
And then next slide. So there's CDC requirements, and then Cal OSHA has also put out requirements that are specific to each industry. They've got industry guidance now, which it was a little bit slim pickings a couple weeks ago, but it looks like it's pretty well covered all the different types of industries that you might have. So the guidance is speaking to specific vulnerabilities. I mean, like Jen was saying, a manufacturing environment and a dentist's office are going to have different vulnerabilities. Fitness centers are going to have different vulnerabilities. So you want to think about those, about what the specific risks are, specific information on high touch areas. So how are you going to go about cleaning that? Or, you know, are you going to require people to wear gloves? What personal protective equipment are you going to be providing? Are you going to have masks, gloves, sanitation? And, you know, the more that you can provide it, the better. The Cal OSHA website is listed there. So if you go to that link and you click on Safe Reopening, you'll see a list of everything that's open, and there's a link to the specific Safe Reopening guidelines for that, and we do recommend that you read them through for your industry. There might be something in there that you hadn't thought of, and you know, really recommend that you provide those safe guidelines to your employees as well. And then another factor, part of those, all of those safe guidelines, is that you are required to train your employees, and it hasn't been super specific on you know, how you document that training, but I'm really thinking it's going to be, you know, potentially something similar to your harassment prevention training, that you're going to want to, you know, be able to show that you had a specific training. This is what you trained people on, maybe have a sign-in sheet. And another shameless plug, we at SDEA can do either webinar training that's specific to your business, or potentially on site if you can do the whole social distancing thing.
Molly mentioned the transparency, and I think when, you know, what we're going to be talking about a lot in the next 30 minutes or 20 minutes or so is some liability issues, because those are some of the challenges that employers are going to start potentially seeing. So I think the more transparent and the more you can communicate to your employees about what you're doing, whether everything that Molly's already been talking about, whether it has to do with bringing employees back to work, how you're choosing who's coming back, who isn't, whether it has to do with your cleaning, what you're doing to keep your employees safe, the sanitation, the PPE that's being provided, you know, et cetera. When we're talking about bringing employees back in the business side of things, I mean, we get the challenge. We know, and you guys do too, you know, acting on behalf of the company, that you have the business side of things, and then of course you have the human side of things. with those employees that are still nervous about coming back. I know we still hear about employees, maybe not always and not a lot of them, but maybe some employees may be using it as an excuse not to want to come in, or, you know, we're not really talking about the unemployment stuff today unless somebody has questions on that later, but there's other reasons why employees don't want to come back to work. And I think the message is that the more understanding you can be, you know, again, outlining for those employees, for example, that are afraid to come back, of letting them know everything you're doing to provide a clean and safe working environment, what you're doing to accomplish social distancing, how you're communicating with employees. Molly mentioned the committees, the you know, who's in charge of safety, that people report concerns or violations, you know, of somebody not doing what they're supposed to be doing in the workforce. Another interesting thing that I just popped into my head that came up in my meeting this morning, and I haven't personally come across this, I don't know if you have, Molly, with any of our members asking, but I think employers will probably be facing this when we were talking about bringing employees back versus having remote work still available to them. And one of the people that was in the meeting this morning said, we're not bringing people back yet because we don't want to have to deal with the tattletales. They don't have time to deal with, they're not wearing a mask, they're not social distancing. But I think this was a great point though, right? And, or, you know, those employees that come in and say, oh yeah, I was in Vegas over the weekend and gosh, it was so great. It was so nice not to have to wear a mask and be around hundreds of people again. And then now they're back in the workplace and freaking everybody else out. So, I mean, I didn't really thought of that, and that some employers are going to say, you know what, we're going to continue, you know, hopefully working at home just so we don't have to deal with all that. But understanding or communicate to employees of who they report that stuff to, and having designated people appointed to deal with complaints. Because we're getting back to work and things are reopening, we still want to consider flexibility, versatility, and not acknowledge what you don't know. I mean, we have to do that frequently, and really because it's changing so frequently. You know, I think the last webinar we did, we talked about you had to take everybody's temperature when they're coming to the office. And our interpretation with the guidelines from the county are that that's changed. That's not a mandatory requirement. You still have to do screening, and that might involve self-screening or asking questions. But, you know, if you don't know the answer, we don't know the answer, and we'll figure it out. And that should be the same, you know, to your, how you're communicating with your employees. You know what, that's a great question. I don't know, but let's find out. You know, we're all, I know we see it on TV ads and everything else, that we really all in this together. Okay, so those employees who can't or won't return to work, you know, considering what is making the plan, what's the order of return if everyone's not coming back to work. Document this process, because when we're thinking about it from a liability perspective, what is the process? How did, just like any other layoff you might have, how did the company make the determination of who's coming back first, or maybe even those employees that aren't coming back at all? What are the needs of the company? What resources are needed? Skills and ability that is needed to do the essential functions to provide the business or the service for your clients and customers. If you're using performance as a reason not to bring somebody back or not bring them back immediately, you're encouraging or making sure that that is well documented so that doesn't come back to bite you. What about your older workers or workers who are especially vulnerable? You know, again, maybe if considering other accommodations, if that is, you know, if they've exhausted all their emergency paid sick leave, PTO, vacation, you know, maybe they're going on an unpaid leave of absence. You know, you can still work with them on what other accommodations they may, I guess if they can't come into the office, you know, really the only accommodation is talking about telework. The employees who are scared to come back, being scared is not a reason to not return to work. Again, I think this is a big communication thing. So we're still hearing a lot of this, you know, I'm nervous to come back. I have little kids at home, or I live with my parents, or my husband has medical issues, and those are valid reasons. This is where we're being sympathetic and understanding and having our humility, remember on the other slide. So that's where we communicate everything that the employer is doing to keep the employees safe. And that's going to fall back to your return to work plan, your reopening plan, what you're having posted, what you're providing to employees, even signs around, everybody's been into the store where you've got the X's on the ground, things just reminding people, wipe down the microwave when you're done. Well, those things, even now that I said that out loud, probably I would ban community microwaves and coffee stations and things from work for a period of time. I don't know, it's just my personal opinion. Another way to really show your employees that you are doing what's best for them is, if you can rely on the experts. Don't assume too that your older workers should not come back. Don't assume more vulnerable employees should not come back. When we're talking, we're going to talk a little bit about more liability issues, but I've started, listening in on webinars and other programs and podcasts and things where employers are already starting to see claims coming in. So this could be a discrimination against older workers. So I'm going to say, everybody over the age of 65, we're not going to have you come back yet. There should be medical reasons, that are documented from a medical provider. Same with your employees that have other medical issues, that may be more vulnerable. Rely on medical certification, document your reasoning. We want us to be able to steer away as much as we can from anything that's going to come back as a discrimination claim. So speaking of the liability issues, I pulled from the Ogletree Deacons. Molly mentioned Chris Olmsted that we have on retainer. He's our attorney, he's from Ogletree. And this is from a recent newsletter that they put out. So they're already starting to see lawsuits that are directly related to COVID. And these were the stats that they put out. Retaliation, 36% of the COVID-related claims are based on retaliation. And retaliation, we're looking at retaliating against employees that maybe, again, are afraid to come back to work. Retaliating against employees who are legally using their leave, whether it's the emergency paid sick leave, the emergency FMLA leave, employers that aren't considering any other accommodations for employees that can't come back. I'm sure there's some retaliation claims that are not justified, but that's what we're seeing. So highest, which is across the board, always the highest claim is retaliation. But look, even 25% of the claims are unsafe working conditions. Molly mentioned the sheriff coming in, and we have to be careful of whistleblowers too. Those employees that are in the office and they're not feeling safe, the employees that aren't wearing their masks, they're not social distancing, nobody's wiping anything down, where those employees might be more likely to call OSHA or call the sheriff department. Wage and hour violations, about 14%, and we're going to talk about more of that, and then disability discrimination.
So specific liabilities that you want to think about in relation to this COVID and return to work, discrimination, and we've got slides where we'll dig in a little bit into that. Reasonable accommodations, the WARN Act, which has been suspended, but it's not completely gone away. You do want to be considering expense reimbursement. That's probably part of the wage and hour claims that we saw on the previous slide. And then workers' comp. So discrimination, reasonable accommodations. As Jen mentioned before, just because somebody's over 65 doesn't mean that they're not able to come back to work. So you don't want to make the assumption that somebody who's 65 or over can't. But if they've got a true, health-related reason, then you want to provide them, as much reasonable accommodation as possible. And, the real emphasis here is on having that medical certification, because that's going to protect you both ways. It will protect you if you've got someone who's over 65 who's saying, well, I don't want to come back to work, I'm scared. If you require medical certification, then okay, this person's, you know, not going to be coming back. If you've got another person who says, okay, I'm afraid to come back too, and you say, okay, well, we need medical certification and they can't provide it, then you can say, well, our policy, our procedure is that we need to have medical certification if you're saying that you can't come back. Of course, doing that with all of the graciousness and compassion that you can. Same with medical conditions or disabilities. And with reasonable accommodations, just kind of digging into that a little bit more, you know, if they've been teleworking, actually, I think we're going to get into this in the next slide, so never mind, I'm getting ahead of myself. But you also want to think about previous leave of absence, you know, was it job protected? Are they currently on a job protected leave of absence? And reasonable accommodations do still apply. So I think now is where we're digging in. Oh no, the WARN Act, okay. So the WARN Act was waived on the state and federal level when all of this kind of first went down, but there is still expectation for reasonable notice. So, you know, as we're coming into, and we'll go through questions, I see that we do have a question that hearing about the PPP program being extended, so we'll ask others to share on that one too. But if you are finding, okay, you know, our PPP loan is running short, or if it's just not feasible or reasonable for you to keep your workforce at the same capacity as you have been, then you do want to provide as much reasonable notice as you can.
Oh, this is me. Oh, this one's for me. Okay. So liability issues, expense reimbursement, and wage and hour claims. So employers in California are required to reimburse their employees for expenses. So even if those expenses do not cost the employee any additional monies. So good example is cell phone, right? So we're at home, we're using our cell phones for work, except for yesterday where a lot of us were unable to use our cell phones at work. But my cell phone, with a lot of people, you know, we have an unlimited plan. It's one set fee. Me working from home and taking my calls on my cell phone is not increasing any expense for me personally. But because it is work related, employers are legally required in the state of California to reimburse expenses for employees. So, you know, cell phone is kind of an obvious thing, but what about, let me think, like if you require meetings, like video conferencing, maybe employees don't have speakers on their computer at home, or they need a camera. Shredders, if they have important documents, maybe some internet access, or they need an ergonomic chair. You know, there may be other things that are going to be associated with expenses where employers are going to have to reimburse those. So make sure that you have, you know, even if it's a stipend where you come up with an agreed amount of money, like I said, for the cell phone usage, of what it's going to be on a monthly basis, so that you're not creating a liability issue, you know, from the employer standpoint of reimbursing for reasonable expenses. Wage and hour claims with non-exempt employees. I think this is probably going to be a big one that we're going to see. You know, if you haven't done so already and you're continuing on the telework and remote work, you know, to make sure that you have outlined very specifically with your non-exempt employees what the expectations are. You know, if you're expecting them, you know, to be working during your, you know, I'm using finger quotes, your regular business hours, if that's 8 to 5, or if you don't care, you just want them to get in their 8 hours of work. It doesn't matter if they're working during normal business hours. Make sure you're communicating that. But regardless, remember, even though they're working from home, your non-exempt hourly employees have to still track their hours worked. They still have to take meal and rest periods. So all of those things need to be documented. It's no different if they're working at their kitchen table than if they're working in their cubicle back at the office. So all that needs to be clearly communicated. I think where we're going to see some issues is working off the clock. now that managers and supervisors can, not that they couldn't before, but they can easily communicate with their employees at home. They know that they have a work email at home, that they've got something set up on their cell phones or their tablets, that it's easier for the managers and supervisors to continue to communicate with employees, like maybe after hours. Oh, I'm going to send somebody a quick text, while I'm thinking of this. That we have to be careful that those non-exempt employees aren't working off the clock. Or, if I'm sitting on the couch and I'm a non-exempt employee, I'm like, oh, crumb, I forgot to send so-and-so something, and I run into my back bedroom real quick and shoot out a couple emails. We have to be really careful that we're communicating with employees, either that it's not okay, or if it is okay, that they're making sure that they're reporting all that time. And for those companies that also may need to communicate that with managers and supervisors, unless it's an emergency, I would say don't send emails and text messages. It's human nature to pull it up and see what it says, to do a quick reply. And if we have documentation that our non-exempt employees are corresponding, it's easy to go and look and see what time emails were sent or text messages. It's pretty easy for those employees to prove that they may have been working during time that they weren't getting paid for. Workers' comp is probably going to be another area, unfortunately, where we're going to see some potential liability issues. So we know, I think last time Molly and I did the webinar, we talked about that Governor Newsom signed an executive order that more or less could make it a little bit easier for employees to file workers' comp claims that are related to COVID. So they still are going to have to prove that that them being recalled to work or being on work premises, that's how they got coronavirus. I don't know personally how easy that's going to be when we're at the grocery store or at Home Depot. Seems like those are the two places I ever go. You're around other family members. Who are you around? I don't know, but this is still a potential issue, where COVID-19 related deaths, unfortunately, Molly more than myself, but we've had to deal with one of our members. And I think they were suing the company, right, Molly?
Yeah, well, they were suing the company for the workers' comp benefits.
Okay.
So,
okay,
which
yeah.
really, they were ultimately going to be suing the workers' comp company,
right,
but still,
yeah.
It's going to be impactful.
So, hopefully we won't have to deal with that, but we've got the related deaths, wrongful death, where maybe again, if an employer wasn't providing a clean work environment, wasn't enforcing social distancing, that these could be things that are going to come back to haunt us. Workers' comp should cover these issues, so I don't see this being a direct suit between an employee or an employee's family and employer, but if it's proven that the employer, like it says, acted recklessly, they weren't doing what they were supposed to be doing, then that could trigger some sort of investigation, because insurance companies, we know, don't want to have to pay out claims if they don't have to. So if you got, getting away from the death thing, because that's pretty severe, but even employees that are ill or sick and they're filing workers' comp claims, if there's a lot going on in your company, I think that's going to trigger some sort of an investigation. Daycare issues is another thing that we are probably going to see rise up again. So schools are closed, mostly. I think most schools are closed now, or will be shortly. So we knew as employers that we had employees that might have to be doing homeschooling, working with their kids, and that made them eligible for some of those emergency leaves that were through the stimulus package. But now that school is over, we might see some more of these things popping up. So be ready for ongoing daycare issues, and probably decide, this is something I would be getting ahead of to see what we're going to be dealing with. How a company is going to handle it. Camps and other daycare providers may not be available. I know they're opening, and I know we say, oh, well, our employees, they have to put their kids in camp even if we didn't have coronavirus. That's not our responsibility, but there may not be the same availability. If the camp normally had 200 kids, they may be only having 100 kids. And I know we can say that's not always our issue, but I would be open and ready to deal with some of these ongoing daycare issues. As far as a liability issue, you know, daycare has historically fallen on the female for caregivers. The dads are now taking on some more of the roles, but we shouldn't make an assumption if we've got the dad walking in to ask for a leave or ask for some time off, saying, oh, well, can't your wife do it? Which I know sounds archaic, but yeah, I've heard it before. So before all this coronavirus stuff, employees would not be eligible for unemployment benefits for daycare issues. But now, because daycare issues can be closed, that could be a thing where somebody might be eligible for unemployment. It's not going to apply for those employees that are afraid to send their kids to daycare, but potentially if daycare is not available. So some of the things we'll be looking at, you know, flex schedules, intermittent leave, you know, are these other things that you can continue to apply for, allow for your employees. You know, if there's no daycare, kids, there's some other schedule they can work. Can they take an intermittent leave? You know, maybe if they've got a partner or somebody else can share the daycare responsibilities, another family member. And then I mentioned about the unemployment.
All right, so going back into the planning, and even if you've already started bringing people back in, I think probably part of the reason that you're attending this is because maybe you're not full force yet. So you just definitely want to make sure that you have a plan in place. And developing a task force, having a representative for each department, you know, if you can only have one person be the safety coordinator, then, you know, if that's your business, then maybe that's the only possibility. But, you know, the more people who are in different departments and who work in different areas are going to have a different perspective. And so the more that you can have, you know, multiple people kind of involved and providing insights, the better. You do want to conduct regular meetings. So, you know, really under Cal OSHA, safety meetings are required for all businesses, even office businesses. So I would say that having those meetings more frequently is probably a good idea. You can also survey your returning employees and ask them what their concerns are. Again, you know, they may have an insight into you know, everybody when they walk in the building touch this one chair, and maybe somebody hadn't thought about that, and you need to either move that chair or wipe that chair down more frequently. So you do want to ask what their concerns are. Of course, with surveys, you want to be careful. You don't want to be asking them about something that you're not going to be able to act on. But, you know, having the survey, asking what their concerns are is going to show compassion. And you definitely want to share the results of the survey, because there's nothing worse than taking a survey and then it's never heard of again, and then employees just take on the attitude, well, this is just lip service.
They're hiding something.
Right. So, you know, you definitely want to have sympathy for your employee concerns. This is a really scary time. You know, it's scarier for some people than others, and that's just human nature and personality and you know, maybe how vulnerable you've been to being sick in the past. There's some people who get sick when any little cold goes around, and other people who never get sick. So, you know, people are going to have different sensitivities just based on their own life experiences. You want to remember that employees have long memories, so it's something that you do now that upsets them, makes them feel like they've been treated wrong. They're going to remember 5 years from now, and the employees that remember stuff for 5 years are the ones who stay. They're not the ones who go and find a new job.
No,
so.
They never are.
So, and realize that employees will get on social media. So it's just a fact in this day and age. You know, I'm sure that you have your social media protocols, and you may want to have that be part of your training in terms of your return to work training, of just reminding them that anything that they say, they, you know, can't be saying it as a representative of the company. But, you know, still, you don't want to get that reputation that you're the employer who didn't care, who, you know, wasn't taking safety measures seriously. So you want to explain to the employees how policies are designed to protect them, and you want to make sure that the company takes allegations of safety and non-compliance very seriously. Just quick little raise of hands here. How many people have been out at the store and seen the person who has a face mask on and their nose is hanging out the top? Anyone? Oh,
Yes.
wow, look at all these hands that are popping up. Yeah, so that is not serving the purpose. And when you're in the workplace, you know, people don't like masks. I get it. They're annoying, but you're wearing that mask to protect other people and to try and stop the spread of the disease. And you really need to emphasize that yes, you know, we get it. Wearing the mask can be annoying, but you just need to do it. And if your practice is that, oh, well, you know, we tell everybody that they should be wearing face masks, but if they're not, we don't do anything about it, that's going to open you up to some liability. And you're going to have to deal with the tattletales. And, you know, your workers' comp carrier may turn around and say, you know what, this is gross negligence on your behalf. So be sure that you really are taking these safety protocols seriously. And express contrition without admission. So, you know, again, I'm sorry. I understand that face masks are uncomfortable. They're necessary for this reason. And, you know, so don't say, yeah, I know, I hate wearing a face mask too, and I'm going to take mine off as soon as I'm 5 feet away from someone. That's not the stance that you want to take. You want to be sympathetic to the fact that things have changed and it may be, you know, may bring some challenges. Another thing though, like especially with the face masks, is you want to think about, does anybody have a condition where they can't wear a face mask for some reason? And so what accommodations might you have to make for that? So you want your plan to be written. So, I mean, it is nice that the County Health Department has provided the social distancing and sanitation protocols and the safe reopening plan templates, because you've got your plan in place. And again, you've got your CalOSHA industry guidance. But you always want to be able to point back to the plan. This is the reason that we're doing this. This is what we have in place. You want to make sure that the plan is well known and shared with all. So just having it and posting those protocols up on the doorway and assuming that everybody's going to read them, I don't think that's going to cover it in terms of providing training for your employees. So again, this goes into transparency, this goes into communication. You want to make sure that you're making it very clear, this is what our safety protocols are, this is our safe reopening plan, these are our safety coordinators, no secrets. So, you know, the idea of, you know, if somebody comes to the office and has COVID and you're like, well, we just won't tell anyone because if we tell people, then they're just going to freak out. Now, while you do need to make sure that you're keeping that person's health information private, you also need to let your employees know if they've potentially been exposed, and we are recommending that you let them use time on the clock to go get a test. You can consider using the third-party expert, so safety, maybe someone in immunology, disease, and I just realized I didn't catch typo, not disease prevention, although it would still be disease prevention as well.
That was me. I wrote that, not Molly.
I know, but I didn't catch it, so we're a team.
All right.
So, so, you know, rather than having just your employee representative who may not be super well versed in safety, you might want to bring in a third party.
And I think that shows too that you guys that companies are trying to get other opinions on what they can best do to keep their workplace safe. Right. So some things that we've seen, I'll kind of get through these last 2 slides real quick so we can get to your questions, but some things that we're seeing employers do. Return to work bonuses. None of these things are required. Well, I shouldn't say all of them, none of them, but they're not, these are not required, but some employers are offering return to work bonuses. especially to help or make things better for those employees that may be losing that $600 in unemployment, kind of an incentive to get them back. Hazard pay, which we talked a little bit about in one of our seminars previously, you know, for employees, probably more so for employees that have been opened, you know, the companies that have been open, the essential businesses, the grocery stores, the delivery services, food, things like that. But some employers are considering hazard pay. Continuing health benefits for employees who are furloughed. Be careful with your continuation of health benefits. I mean, I think it's generally okay, but if you have somebody that is not who's not working, they don't have any hours and they're filing all these benefit, you know, all these claims, and the insurance company finds out that they're not meeting the 30-hour minimum or whatever it is, that could be a problem. So, you know, work with your carrier, your broker, to make sure that you're in compliance there. Subsidizing childcare, again, because I think this is going to be a bigger issue going forward. I've talked to, I think, one company, so it's not saying it's very popular, that is actually considering bringing a childcare provider on site. So, you know, I don't know, something you may consider. Severance pay for employees that you will not be bringing back. So conclusion before we get to your questions here, you know, we've got to have perspective. And I know we've heard this before, in addition to we're in this together. This is unprecedented, all the terms that we probably never want to hear again. This too will pass is probably in that category, but it will. We'll look back at this probably as not very fond times, but we'll be looking at it in our rearview mirror eventually. Point here with bringing employees back to work and those challenges, we are looking to create goodwill, be transparent, talk about policies, be empathetic. Employees will remember those employers who treated them well as those who did not. And really think about, you know, you are creating your reputation for the future, not just for your current employees, but for recruiting when we get back to that phase, and you know, what your public image is in some cases. Okay, so we will open up for your questions now. I know Molly mentioned the one on the PPP.
Yeah. So we've got some questions. We've got, hasn't the PPP program been extended to December, or has that not yet been finalized? Last I heard, they were talking about extending it to 10 weeks rather than 8. Jen, have you heard anything
beyond that? I have not heard anything final on that. And so we can find out. Well, so when we do our Q&A back to you guys, we'll find out. But I think one of the points with the money, I think, and maybe I'm wrong because I'm not experienced super, you know, in the PPP, but I think whether it's 8 or 10 weeks, employers are going to be running out of the money regardless. So, you know, right? So you're still looking at potentially, maybe, hopefully not, but having to do layoffs or furloughs once that money's out, regardless if it's 8 weeks or 10 weeks. So, but we'll look and find an answer for you guys.
Right. And then we've got the conflicting answers about temperature checking. And again, you know, whenever we provide answers, I think we're now to the point where we know we just need to put a date on it. Because something that was set in stone last week, no, you must provide temperature checks there now. Oh, well, maybe you don't have to do that.
Right.
Which, you know, to the dismay of the touchless temperature checking manufacturers.
Right. Yeah. All the orders, all the Amazon returns.
Yeah, exactly. So that's another one. I think we'll look into it and see, you know, as of maybe the end of this week, what is it that they're saying. But I think kind of a big thing to think about with that is that the EEOC has said that it's okay to do that. So even if the county is not mandating it, if you are erring on the side of caution, you may want to just do it, because that's going to be part of making sure that we have a safe work environment, is that we do a temperature check on all of our employees and the people who have temperatures we send home. Because, you know, if your protocol is, okay, well, our employees take their temperatures when they're at home and whatever, sign off saying that they did it, well, are you really exhibiting control over that, and where is that liability then going to end up coming up? Jen, do you have any other thoughts on that?
No, I think you made the main point, which I think is, you know, if the county isn't saying it's a requirement, it doesn't mean that it's still not permitted. You're still allowed to do it. And so I think, like you just said, Molly, piggybacking that you do what's best for your company. I know some employers were not comfortable with it, or there's going to be, you know, large groups of people gathering. How do you deal with social distancing? And those are all things you need to work out in your plans. But I just want to touch Amy real quick. So it says, I see you've put the thing here from the county that says the temperature checks are not required, but then are your attorneys saying that are they disagreeing with that, or is this just your company policy? I guess I was just looking for confirmation. So we'll get back to that one. Reimbursement for cell phones. How do we determine how much of their cell phone bill and or internet access would the employer reimburse for? That's a great question. It's the unknown. I think most employers are just picking a dollar amount for a stipend. I think $50 a month is kind of standard that I hear. I don't know if anybody has any different opinions or input on what you're doing. You know, as with a lot of other things in the HR and employment law world, it has to be quote unquote reasonable. Are you seeing anything, Molly, specific on that?
Well, I mean, right when the whole working from home thing was kicking in, I actually put together a spreadsheet where I looked at, okay, how many hours are there in a week and how many hours are you expecting the employee is going to work in a week, and break down that way. Okay, if you're thinking that the average cell phone plan for an individual is $50 and the average internet plan is $50, then you know, the two together, basically $50, actually $50 is generous compared to what my analysis showed would be reasonable. So, you know, I mean, I think a thing to realize is that, you know, just because your employee has, you know, their family of 5 plus their cousin on their plan, that doesn't mean that you're responsible for paying the entire plan.
No.
So, you know, I know people have cell phone plans that are, you know, hundreds of dollars. So you just, you know, you want to make sure however you're figuring it out that it's reasonable and that it's consistent.
Consistent for sure. Yeah. Whoops. Quick question. Do you think having an HR member taking, what do I think about an HR member taking the temperature at the door? I don't think it matters who it is. Actually, HR might be a better choice because of confidentiality and they understand maybe some of those rules a little bit better. But I think whoever's taking the temperature needs to be trained on the protocols and privacy and confidentiality and social distancing and all that. I don't think it really matters if it's HR or somebody that's designated from your new COVID team.
Yeah, and another thing to think about, because it really hasn't been addressed of how are you documenting that you're even doing this? So I've had a lot of members being like, how do we document it? I'm like, well, you know, you can have a spreadsheet and you can just have it be yes or no that you took the person's temperature, and then, you know, did they go home or not? And, you know, how is the need for this documentation going to come back? We don't know at this point. But again, you know, if you have an environment where your employees are feeling like they're being recklessly endangered, and so if you're not enforcing people wearing face masks and you're not enforcing any kind of social distancing and you're not training your employees and communicating to your employees what the safety program is, and you haven't documented that you're taking anybody's temperature, all of that is going to lead to, yeah, what are you doing? You're not doing anything, right. I would think.
Right. So we did have somebody comment on here that the PPP program has been extended to 24 weeks. So again, not that we don't believe you, Paul, but we'll confirm that and send out the information. Yes, the PowerPoint will be, well, the program will be available on our YouTube channel. What else? Okay, so question here, how can we get our building manager to cooperate with increased sanitation? Good question. Ours are refusing to do anything additional with the shared bathrooms other than additional cleaning each night. They refuse to pay the janitorial service to do additional daytime cleaning. Does this then fall on the tenants? Handrails, elevators, should a building manager be providing wipes at the elevator doors? Well, I can know from our experience, even though we're still working from home, I'm in the office about once a week, and I've gotten to know our cleaning guy very well. He's doing double, triple duty. He's wiping down. So I guess we're fortunate. He's always wiping down the door handles, stair rails. Our bathroom doors are permanently propped open. I mean, they're still private, you know, but so that there's no, you don't have to use the handles going in and out. I mean, I am under the understanding that that is the responsibility of the building manager. Do you have any insight on this, Molly, or is it something we can?
Yeah, I mean, it is the responsibility of the building manager, and if they're not doing it, there's an anonymous tip line. I mean, snitch them, call the sheriff.
Yeah.
You know, I mean, I would start with, hey, you know, this is important and this is a requirement, but if you've already done that and they are not being in compliance, then maybe it takes a visit from the sheriff for them to realize that they need to do that.
Yeah, because they're a business just like any, but even though there's different tenants within that building, their business is opening up the building for the tenants, and they have to have that reopening plan and what they're doing for their customers and clients, which are you guys. So they need to be doing all that stuff too.
Right.
Okay, is the San Diego rule that masks have to be worn, or is it mask or social distancing without a mask? Is temperature check always a San Diego requirement for any employee entering the office for any period of time? Okay, so is the San Diego rule that mask has to be worn, or is it mask or social distancing? So it's mask or social distancing. So you have to have a mask, or you have to have a face covering. So you have to have a face covering. If your employees are unable to social distance, then they have to have the mask on. Am I interpreting that correct, Molly? Jump in if I'm saying something incorrectly.
No, that's the way that I understand it as well, is that if they're, you know, 6 feet apart from each other, then they don't have to be wearing the masks all the time, but they need to have a mask on their person, because as soon as they get up and, you know, walk around where they may run into somebody within 6 feet, they need to be wearing a mask.
Right. And the temperature check, is it a San Diego requirement? That's one thing we're going to go back and confirm. It's like, I think from what we're hearing and getting some confirmation from you guys is that the county has said it's not a requirement. You have to do, what word am I thinking of? You have, survey isn't the right word, but you have to check your employees some way or another. It doesn't, from what we're reading, the temperature check is not required, but we're going to confirm that.
Right. And then are there any businesses that can't reopen? On the webpage that we shared earlier, the San Diego Health Order, when you click on the Safe Reopening Plan, there's a list of all the businesses that are currently open and the ones that still aren't allowed to be open. And that's changing weekly.
Yes.
And then with call centers, again, it's still strongly encouraged that if your employees can telecommute, that you allow them to telecommute.
Right. Workers' comp liability, isn't workers' comp liability on the employer either way due to California law? So is the most cautious approach worth it? Yeah, I mean, anytime that the employee can show or prove that they got sick or injured due to work, then it's going to be on the responsibility. It's going to be covered by your workers' comp insurance. And I think with COVID, some of the things we're discussed here earlier were, I don't know how easy that's going to be for somebody to prove. Again, you know, if we're at the grocery store or if I have family members over on the weekend, you know, how they contracted that. But I think this is going to fall back to everything that the employer is doing to provide a safe working environment with the screening. There's the word I was thinking of. With the screening of the employees, if you are doing temperature checks, your cleaning protocols, your social distancing, all those, if an employee, you know, filed a claim, I think you're going to be beneficial in helping the employer fight it or say that it was not work related.
Well, but Jen, last I read, Gavin Newsom's executive order said that if you go to work somewhere other than your residence and you get COVID-19, it's automatically a workers' comp claim.
All right.
Have you seen something different from then? Because this is all changing.
No, I haven't. No.
Yeah. So, I mean, I think that you would be really hard pressed under the, I mean, and I think that the workers' comp insurance companies are going to fight this tooth and nail. But as of right now, that's my understanding is that Gavin Newsom has said you send them back to the office, then if they get it, that's going to be workers' comp.
All right. Thank you for the clarification. I'll take the easy question on the mask then. Does the employer have to pay for masks? You do not unless you have because masks are generally required just to be in the public, that the employees have to have some sort of a face covering anyhow. So unless you have special requirements, you want the fat mask with the company logo on it, or you have a face shield or something different than a cloth face covering, then you do not have to provide it. And yeah, we just confirmed, Heather, what Molly just said about Newsom made it, the order of COVID's on the employer regardless. So I misspoke.
Right. Well, but that's as of right now.
Yeah.
Because I am sure that workers' comp carriers are going to be like, no way.
Yeah, right. So I think we got all the questions. Did you see any lingering, Molly?
No, I don't think so. Okay.
All right, you guys. Well, like we normally do, we'll follow up with you. If anybody that needs the HRCI code for your PHR, SPHR, there you go. I will say we should be doing this on a regular basis. Next week, Molly is doing another webinar on hiring from home and what that looks like remotely. You can probably speak on it better than I can, Molly. It's your class.
Yeah, I mean, basically, you know, the whole hiring practice is different when you're doing it remotely. So how are you going to go about doing that? And, you know, are you going to use Zoom meetings, or how do you do your I-9 and your onboarding? So we'll just talk about kind of all of those nuances.
Yeah. Yeah, so check that out. I think it's the 26th, isn't it?
It is the 20.
Sorry, put you on the.
Yeah, 24th, Wednesday.
24th. All right. Okay. So if anybody has any other questions, here's Molly and I's contact information, and otherwise we'll be making this information available. Oh, and I will be sending out shortly a evaluation. If we really appreciate the feedback, and it helps us with our grants with the San Diego Workforce Partnership. So look for that to come out soon. Other than that, no questions, it looks like. So we're going to bid you adieu, and I hope everybody has a great rest of your week, and we'll be talking to you soon. Thank you.
Take care, everyone.